Central lines are becoming increasingly common in surgical settings. These lifelines provide crucial access to the circulatory system. They allow medical professionals to administer fluids, medications, and draw blood. Central lines are especially useful for patients undergoing complex surgeries or those requiring long-term intravenous access. Their use has significantly improved patient care in recent years. As surgical techniques advance, the need for reliable and efficient vascular access has never been greater. Central lines offer several advantages over traditional peripheral intravenous lines. They allow for the administration of medications and fluids that would irritate or damage smaller peripheral veins. This is particularly important for patients receiving chemotherapy or long-term intravenous nutrition. One major benefit is the reduced risk of thrombophlebitis, a painful inflammation of the vein. Central lines also have a longer lifespan than peripheral lines, reducing the need for frequent replacements. Many central lines are multi-channel, allowing for simultaneous administration of multiple medications and fluids without the need for multiple insertion sites. This is crucial for critically ill patients who require complex medication regimens. Inserting a central line is a sterile procedure performed by a trained healthcare professional. The preferred site is typically the internal jugular, subclavian, or femoral vein. Ultrasound guidance is now standard practice, allowing for precise needle placement and minimizing the risk of complications. The procedure begins with selecting and preparing the insertion site. After applying a local anesthetic, the physician uses a needle to access the vein. The Seldinger technique, a wire-over-needle approach, is then employed to insert the catheter. Section 4. Navigating potential complications. While generally safe, central line insertion does carry potential risks, as with any medical procedure. Pneumothorax, a collapsed lung caused by accidental puncture, is a rare but serious complication. Bleeding, while usually minimal, can occur, especially in patients with bleeding disorders. Arrhythmias or irregular heartbeats can occur if the catheter tip is malpositioned. Infection is a significant concern, and strict, sterile precautions are essential to minimize this risk. Section 5. The importance of sterility and immediate action. Maintaining strict sterility throughout the procedure is paramount in preventing infections. This includes using sterile gloves, gowns, drapes, and equipment. The insertion site should be thoroughly disinfected prior to the procedure. If any signs of infection develop, such as redness, swelling, pain, or discharge at the insertion site, the central line should be removed immediately. Prompt treatment with antibiotics is crucial in managing infections related to central lines. Section 6. Conclusion. Central lines, a vital tool in modern surgery. Central lines are an invaluable tool in modern medicine, particularly in surgical settings. They provide a reliable and efficient means of administering fluids, medications, and monitoring vital signs. While potential complications exist, they can be minimized with proper technique, sterile precautions, and vigilant monitoring. Central lines have revolutionized patient care, improving outcomes and enhancing recovery. As medical technology continues to advance, central lines will likely play an even greater role in the future of surgery.